If you've got some pain along the sort of medial border of the shin, there's a muscle here, tibialis posterior. It does inversion. The foot comes here, all the way down into this area here, and it does inversion. So if inversion bothers you, you can be pretty sure you have a tendonitis of this muscle. So you can start off with desensitizing it with something like a lacrosse ball, tennis ball, any kind of firm ball, baseball would work, and just do some pressure slow and deep into the muscle. If you find a spot that's particularly tender, sustain that pressure there. Okay, so spend about a minute or two doing that. Alternatively, you could take something like the back of a butter knife, get some lotion on it. You can scrape the area. Keep it at about a 45-degree angle. You scrape down, lift up. You just do it kind of quick like that. The goal here is to get the area kind of pink. Usually takes about a minute or so. All right, take some of that lotion, give yourself a little massage. Same as the way we did it with the ball, just nice and slow, deep pressure. Sustain it in a spot if you find a sort of a trigger point there. After that, you can always pick up a set of these, the silicone cups. You can get these on Amazon for about 20 bucks. These are great. All right, just start to cup the area. I'm not a huge fan of just leaving it in one spot for a long time and leaving a big hickey. That's not what we're going for. I don't want to break capillaries. I want to keep the movement. And if you can, add some movement with it. Also about a minute or two on this.